Celebrating service in Nye County for 10 years, Desert View Hospital.
We had a great conversation here at the hospital talking about some of the advances, some of the things that are going on here in Pahrump. First of all, let me just say it's great to be back in the community. I enjoy spending a lot of time out here, and this is an opportunity to work with the hospitals and these doctors and find out and discuss what's going on. Most importantly, what we can do back in Washington, D.C. to make sure that hospitals like this continue to expand and provide the services that the community needs.
He's been here before. He's seen this develop from the time before there was even a hospital, and I think so. I'm very satisfied with our visit, and we had a good exchange about what's going on here and where we're going.
Our concerns is the services that we can provide to our patients, so they don't have to go over the hill to Las Vegas. I always say that, when I have a 91-year-old father and an 86-year-old mother, I don't want them traveling 50, 60 miles for their health care. So it's very important that we can provide our services here in town.
That's true. And if you're not feeling well, just traveling over there, right?
Yep.
Absolutely. And as the services increase, the ability to keep the patients in the community increases. One of the reasons we're talking today, a conversation we had was about the Affordable Care Act and how we're going to try and protect that and keep it in place so we can make sure that patients can get the care that they deserve and need. But in addition to that, there's a new fiber line that came into the hospital this week to facilitate our imaging and be able to provide the information back and forth to the same quality that any community in Las Vegas has, we now have at this hospital, have had, but this just expedites it a little bit more. So we're grateful to Valley Electric for being able to do that and provide those services to us.
And with the VA clinic right next door, I know that you had a couple of concerns that you addressed to the center.
Well, I think we're concerned. We want to make sure that our veterans are able to get the services that they need in the community when they can get them. The senator's office and staff have been extremely helpful in facilitating that and making sure that the folks here get the services that we can provide. There's no reason for them to go, as Susan said before, over the hill for services that we can easily do here.
It's important to have these one-on-one kind of face-to-face conversations with the medical providers here as well as the staff here at the hospital, isn't it?
No, I agree, and I do it all over the state. Have these kind of conversations, and I'll tell you I'm impressed. I think this community is fortunate to have Susan and James on their behalf and the doctors that we see here at this facility. They do a great job, and as James mentioned earlier about the VA, just the fact that our veterans can stay here in town, and let's expand those services and make sure that the relationship that they have with this hospital continues to expand so we can give these veterans the kind of health that he or she deserves as we move forward.